Ever found yourself just, stuck in that relentless cycle of chronic pain? I'm not talking about a quick ache, but that constant nagging thing that just hangs around. It messes with your sleep, your mood, really your whole life. Maybe you've gone down the usual routes, tried medications, but you're still hunting for something else, right? Something that gives real relief. Okay, so let's dig into this. Today, we are doing a really deep dive into acupuncture, specifically how it fits into managing chronic pain. We've gathered quite a stack of recent solid research systematic reviews, meta-analyses, some just out in 2023. This isn't just guesswork. It covers everything from, well, does it work, clinically speaking, to how it actually affects our immune system and even, changes our brain activity.
Yeah, and what's so fascinating, I think, is seeing how this really rigorous research, we're talking huge meta-analyses with thousands of people, detailed fMRI scans looking right inside the brain, how it's starting to connect this ancient practice, thousands of years of tradition, with our modern scientific understanding. So our goal today, really, is to pull out the most important pieces from all this information, the key takeaways, so you can walk away feeling properly informed about what acupuncture might offer in today's world of pain management.
Okay, let's start broad. What exactly is chronic pain, and why is it such a massive, just global issue? We're not talking about, like, a sprained ankle healing up. This is pain that sticks around for months, sometimes years. It becomes this really complex thing, way beyond just the physical hurt. It hits your health, sure, but also your quality of life, leading to stuff like anxiety, depression, even measurable changes in the brain itself. It's huge.
And that really highlights the central problem, doesn't it? Traditional methods, they often fall short or they come with some pretty serious side effects, especially long term. So it naturally raises the question, what other options are out there that are genuinely effective and safe? Which is exactly why looking closely at acupuncture feels so, well, relevant right now for so many people. It's about finding ways to work with the body's own healing systems.
Right. So with that big picture in mind, what does the hard science actually say? Does acupuncture work? You mentioned a big meta-analysis from 2016, a real landmark piece, looking at, 63 trials, over 6,000 people? That's substantial.
Absolutely substantial. And the main finding, sort of the headline, was clear. Real acupuncture was better than the sham controls for musculoskeletal pain. That's a pretty strong starting point.
Okay, better. But how much better? You mentioned a moderate effect. What does that actually feel like for someone in pain?
Good question. So moderate effect in this context meant about a 12-point reduction on a 100-millimeter scale, the visual analog scale. Think of it like this. If your pain's a 70 out of 100, maybe acupuncture brings it down towards, say, 58. Now, that might not sound like waving a magic wand, but for someone living with constant pain, that 12-point shift, that can make a real difference in daily functioning. And importantly, the effect on disability, so being able to do things, move around that, was actually even larger.
That disability improvement part sounds really key, getting back to daily life.
Exactly. It's about reclaiming function.
And what about the downsides? Side effects are always a concern, especially with long-term treatment. How does acupuncture stack up there?
That's another really important piece. The incidence of side effects reported with acupuncture in these studies was significantly lower compared to common drugs like opioids or NSAIDs, those anti-inflammatories. When you're dealing with pain day in, day out for months or years, minimizing those adverse effects is, well, it's critical. It really adds to the appeal for many.
Okay, so overall positive for musculoskeletal pain, lower side effects. But you mentioned it's not quite a magic bullet for everything, right? It gets more nuanced. That 2016 analysis, did it break it down by specific conditions?
It did, and this is where it gets really interesting. The effectiveness wasn't uniform. So for things like chronic neck pain, shoulder pain, that persistent low back pain, myofascial pain, which is basically muscle pain, trigger points, and osteoarthritis, real acupuncture showed a clear advantage over the sham. However, for other conditions like fibromyalgia or general arm pain or rheumatoid arthritis, the same rigorous evidence didn't show a significant difference compared to the sham procedures.
So it works well for some things, but maybe not others.
Precisely. And it really underscores that pain is complex, conditions differ, and treatment needs to be tailored. It's not a one-size-fits-all scenario. If we zero in on osteoarthritis for a moment, another meta-analysis from 2014 did find significant pain reduction, better mobility, improved quality of life, which is great. But it also noted that the size of the difference, while statistically significant, wasn't perhaps as large as seen for some other conditions in other reviews. It brings up that important distinction between statistical significance and clinical relevance.
Right. The difference between does the number change on paper
Right.
And does this actually make a meaningful difference in someone's day-to-day life?
Exactly that. It's a crucial point in interpreting any medical research, really. A small statistical blip might not change how someone feels or functions. It helps us understand why some people might rave about a treatment while others find it less helpful, even if they technically have the same diagnosis.
Okay, so we've got a pretty good handle on the does it work part, at least for many common pain types. Let's shift gears to the how. This is often the big question, isn't it? How does sticking needles in specific spots actually do anything? You mentioned it's not just about the needles. There are complex biological things happening.
Oh, absolutely. We're moving beyond just observing effects to understanding the mechanisms. And a really fascinating 2023 review looked specifically at how acupuncture influences the immune system. What's really neat is how this modern science kind of mirrors the traditional Chinese medicine idea, the holistic view that acupuncture helps mobilize the body's own self-healing abilities to get back to balance or homeostasis.
Mobilizing the body's own repair crew. I like that analogy. Can you break that down a bit? What's happening at like the cellular level? Who are the key players?
Sure. Let's start with mast cells. You can think of them as immune cells stationed in our tissues, often packed pretty densely near known acupoints. When the acupuncture needle goes in, that precise mechanical stimulation can trigger these mast cells to, well, essentially release their contents. It's called degranulation. They release a whole bunch of biologically active stuff, things like histamine, tryptase, even ATP, which, we usually think of as cell energy, but here it acts as a pain reliever too.
Wow.
So this release basically translates that physical needle stimulation into chemical and nerve signals, telling the body, okay, respond here. It's a very direct link.
So it's like flipping a switch, setting off a local chemical cascade that then spreads.
In a way, yes, but it's not just local. Then you have macrophages. These are major players in our innate immune system, kind of like the cleanup crew, but also involved in signaling. Acupuncture seems to influence their behavior, specifically their polarization. Think of them as having different modes. There's a pro-inflammatory mode, M1, which is good for fighting infection, but can also drive chronic inflammation and pain. And then there's an anti-inflammatory pro-healing mode, M2, focused on repair. Studies, particularly in animals, show acupuncture helping to shift macrophages away from that inflammatory M1 state towards the healing M2 state.
So it dials down the inflammation and turns up the repair signal.
Exactly. It helps reduce inflammation in models of inflammatory pain and has even been shown to help muscle tissue repair itself more effectively. This suggests it's tackling some of the underlying processes driving the pain, not just masking it.
Okay, mast cells, macrophages. What about neutrophils? Aren't they usually involved in more acute, like, infection fighting?
They are typically the first responders to infection. But acupuncture's influence seems to extend to them as well. It can help regulate their numbers and activity. For example, there's research showing it can help improve immune protection in cancer patients going through chemo, which is obviously vital when their systems are suppressed. And perhaps even more striking, some animal studies on sepsis, that really dangerous systemic infection response, showed improved survival rates with acupuncture.
Sepsis. Wow, that's pretty systemic.
It really points to acupuncture having these broader system-wide effects on immune regulation, far beyond just the spot where the needle goes in. It's modulating the body's overall ability to respond and heal.
Okay, so the immune system link is fascinating. But then there's the brain. You mentioned fMRI studies, actually seeing changes in the brain with acupuncture.
Yes, and this is another incredibly exciting area. A 2022 meta-analysis specifically looked at fMRI studies of people with chronic pain undergoing acupuncture. What we know is that chronic pain itself actually changes the brain. It can rewire circuits, making it harder for the brain's own pain control systems to work properly.
Circuits stuck in a pain loop.
Kind of, yeah. And these fMRI studies show that acupuncture seems to help modulate or sort of retune key brain networks that are disrupted by chronic pain.
Retune. Which networks are we talking about?
Two main ones stood out. First, the default mode network, the DMN. This is often described as your brain's daydreaming or mind-wandering network. It involves areas like the precuneus, the posterior cingulate cortex. It's very active when we're thinking about ourselves, ruminating, maybe worrying. In chronic pain, this network can become overly active, often linked to the negative emotions and suffering that go along with the pain.
So it's tied into the emotional burden.
Exactly. And the fMRI study suggests acupuncture helps to, let's say, normalize activity in the DMN. It seems to quiet down some of that excessive negative internal chatter associated with the pain experience. It helps with the emotional and cognitive side of things.
So it's not just dulling the physical sensation, it's helping the brain cope with the whole emotional weight of it all.
Precisely. It's addressing the suffering component. And the second key network is the frontoparietal network, or FPN. This network involves parts of your frontal lobes and parietal lobes. It's more like your brain's executive control center involved in attention, focus, decision-making, cognitive control. Acupuncture appears to modulate activity here too. This network is critical for how we consciously perceive pain, how much attention we pay to it, and how we regulate our response.
So it helps us manage our reaction to the pain.
Yes, it's just a top-down regulatory effect. The brain itself becomes better at processing and filtering those pain signals, perhaps giving you a greater sense of control over the experience rather than feeling completely overwhelmed by it. It's like recalibrating the brain's pain processing.
This all sounds incredibly sophisticated. But, like with all science, there must be challenges, right? You mentioned sham acupuncture earlier. That seems like a tricky area for researchers.
Oh, definitely. It's one of the biggest methodological hurdles in acupuncture research. You need a control group, something to compare real acupuncture against. But what should that control be?
You'd think sham would be like a sugar pill, totally inert. But you're saying it's not that simple.
Not really, no. The research raises this really important question. Is sham truly a placebo? Many forms of sham may be using blunt needles that don't break the skin, or very shallow needling at non-acupoints might not be completely inactive. Why? Because even minimal stimulation, that light touch, can still activate sensory nerves. There's something called the limbic touch response. Gentle touch can activate parts of the brain involved in emotion, the limbic system. So even a sham procedure might trigger some non-specific physiological effects, perhaps influencing mood or even pain perception to some degree, just through touch and expectation. It makes it really hard to isolate the specific effects unique to true acupuncture needling at the correct points.
So the baseline you're comparing against might actually be doing something itself. That definitely complicates things.
It really does. It makes it harder to be absolutely certain about the size of the specific acupuncture effect versus these more general, non-specific effects that might come from the ritual, the touch, the expectation.
And that leads into other limitations, I guess, like study quality.
Exactly. Many reviews, even the big meta-analyses, point out weaknesses in some of the included studies. Things like an unclear risk of bias, meaning the study design might have accidentally skewed the results. Or problems with blinding. Ideally, neither the patient nor the person assessing the outcome should know who got real treatment and who got sham, but that's notoriously difficult with a physical procedure like acupuncture. If blinding isn't perfect, it can inflate the apparent benefits.
Right, because people might report feeling better if they think they got the real deal.
Precisely. And then there's the whole factor of patient expectation and preference. These are rarely measured systematically in studies, but we know they can have a huge impact on how someone responds to any treatment. If you strongly believe acupuncture will help, you're arguably more likely to experience benefit.
So pulling all that together, while the evidence looks really promising, especially for certain conditions, there are still things we need to figure out, like nailing down the best way to use it, and maybe finding even better ways to study it.
Absolutely. The evidence base is growing and becoming more robust, particularly for musculoskeletal pain. But there's definitely more work to do. We need more research on optimal dosing, how many needles, how often, for how long, what works best for specific types of pain. And yes, the challenge of designing truly inert and convincing sham controls. That's an ongoing quest for researchers, critical for teasing apart those specific versus non-specific effects with even greater clarity.
Okay, so we've covered a lot of ground today. We've gone for the big picture of chronic pain, seen some pretty compelling clinical evidence for acupuncture, especially for muscle and joint pain, dug into how the effects on the immune system, activating mast cells, macrophages, influencing neutrophils, and even looked at those fascinating fMRI studies showing brain network changes, like with the DMN and FPN.
Yeah, and I think the takeaway is that while research is always ongoing, always refining things, the current evidence really does support considering acupuncture. It's a viable option for many people dealing with chronic pain. It has a good safety profile, and it can be a powerful alternative or something used alongside conventional treatments, offering another avenue for relief and getting back to a better quality of life.
So here's a final thought to maybe chew on after you stop listening. We've seen how interconnected everything is, immune cells talking to nerves, needles influencing brain networks. Considering this deep interconnection, how might future research into acupuncture or maybe even other similar therapies not just improve pain treatment, but actually shift our whole understanding of health, of healing, of the body's own amazing ability to regulate and repair itself? Could these ancient practices hold keys to, I don't know, entirely new ways of thinking about wellness?